Hosted by Dr. George Gaitanos, Chief Scientific and Operating Officer at Chenot. This podcast explores what truly improves health and functionality, detoxification, nutrition, sleep, metabolic health, and more. Join Chenot experts and guests for clear, evidence-informed conversations with practical takeaways you can use today. Let's begin.
Hello and welcome. Today we're discussing a shift that matters to anyone who wants to stay sharp, capable and independent for decades, moving brain health from late-stage disease care to early prevention. My guest is Dr. Antonella Santuccione Chadha, medical doctor and global leader in brain and mental health, trained in neuroscience and psychiatry, and driven by a lifelong curiosity about how and why the brain ages differently in different people. Her career spans academia, global pharmaceutical companies such as Roche and Biogen, the Swiss Regulatory Authority, digital health innovation, and international policy, giving her a rare view of how science becomes medicine. She is the founder and pro bono CEO of the Women's Brain Foundation, created to close one of the biggest gaps in medicine, understanding how sex and gender shape brain health, disease, and prevention. Dr. Chadha has led large multidisciplinary teams and today advises InnoSwiss, supporting the future of Swiss innovation. Dr. Chadha's work has been recognized globally with honors including Top 100 Women in Business in Switzerland, Woman of the Year, and multiple international awards for advancing precision medicine and scientific leadership. She is the author of numerous scientific publications and several books, including Una Bambina Senza Testa, a deeply personal and autobiographical work that reflects her human approach to science, resilience, and leadership. So, Dr. Chadha, dear Antonella, welcome
George.
to our podcast.
Thank you. Thank you so much.
Let's start. And the first thing I want to ask you is you worked across neuroscience, psychiatry, pharma, regulation, and innovation. What first drew you to brain health?
Well, brain health has become part of my professional and life mission. And that's because when I started as a very young researcher and medical doctor, I got fascinated by the brain. The brain was for me one of the most mysterious organs of our entire body, and actually still is. If you think how much we know about the heart or how much we know about a kidney, still we know very little about how the brain functions. And I love challenges. So I think for me that was the biggest challenge to embrace as a researcher, as a doctor, understand the mystery of this important organ and, study it, prioritize also.
And you feel this kind of mission still feels urgent today?
It is absolutely urgent for a main reason. The brain remains the organ which controls our entire functioning and our entire body. Nevertheless, treatments and cure for brain and mental disorders are still very scarce and with limited effects. So I think that for me, the urgency it is to prioritize neuroscience, research, but also clinical development and preventative measures to have a functioning brain, what we define with brain health. And brain health, it is really fostering the well-being of this precious organ, prevent any type of mental, neurological condition, but also prevent substance abuse, allow that this organ develops at its best and that it functions the best possible way for each of us. Everyone has a different brain, that's a given. So I think that we should add one word to brain health, precision brain health, because what might be brain health for me might not be brain health for another individual. And even in the presence of a disease, you still have to allow that brain thrive and function the best possible way.
So really moving from treating disease to treating brain health.
Right.
Yeah. How can we do this?
I think I've used already one word, which is prevention. I think that there are two pillars that must be implemented from very early on in our life. One, it is education, and one, it is prevention. We need to educate at how the brain is precious for each of us and how to have lifestyles and behavior that prevent us of developing these mental and brain diseases. That's not easy. It's not easy because we know how hard it is to change our behavior, how hard it is to implement new way of living, and how influenced we are by society, by the pressure we have from performance. And the brain, it is our performance organ, whether we like it or not. But I think that if we start already in school, in young age, and to educate what it is brain health and implement preventative measures as a society, we have an opportunity. Of course, you need to have the individual will, you need to have the societal and political will, and you need to change a lot of things currently, because
You need to put all the people around the table
absolutely
for the conversation.
Absolutely. All stakeholders are involved and must be involved. I'm just back from the World Economic Forum, right? This was a couple of weeks ago, and I was pleased to see that brain health and the so-called brain health capital was on the agenda, together with the fact that this goes direction living well and longevity, because there is no longevity without brain health, and there is no brain health without longevity. I mean, that's really an equation that goes hand to hand.
Tell us a little bit about the Women's Foundation.
Sure.
What is you working on at the moment?
The Women's Brain Foundation is currently very busy. It's a time of transformation and expansion. The team is growing, and our priorities are mainly towards an educational academy where people can join and get knowledge about the science that we have been producing over the last 11 years. It's about 120 plus peer-reviewed publications on topics of sex and gender precision medicine, spanning from Alzheimer to Parkinson to depression, cardiovascular. We were even very, very busy in COVID time, saying that actually more women were exposed to COVID, but were less impacted than men, for example. So all this knowledge is now within the Educational Academy of the Women's Brain Foundation. We are conducting research project that can be supported by, any type of contribution. This is an independent research activity that it's done by a foundation which is a non-profit registered in Switzerland, and we need support, philanthropic endeavor, donations to continue the great work of the scientists and the people at the foundation. What we're also doing, it is establishing an accelerator for startups that are in the space of brain health and women's health. We want to foster innovation and make it at the speed of life, prioritizing this unmet need. We have the knowledge, we have the pool of experts, we have the capacity of doing compelling science, but also driving towards business development, market access, clinical developmental strategies, etc., etc. Finally, but not least, and this is what maybe it's the most dear topic to me. Actually, there are two dear topics to me, and I'll tell you also a scoop. I have a scoop for you. The most dear topic to me is policy. I think that we can do as much as we want, we can talk as much as we want, but if policymakers do not get what it takes to prioritize longevity on a population base, to prioritize brain health on a population base, to do sex and gender precision medicine, to do, also the capacity of healthcare system infrastructure of absorbing innovation, because we can have the most innovative solutions, but if the healthcare system is not ready, we will see drug approved, right, but not reimbursed for. That's not helping anyone, because it will be only accessible to the richest of our population, even if, because still the doctor will have to decide to prescribe it or not. So that's what, we are doing. There are these four elements of innovation, accelerator, academy, educating the lay public, policy making, and finally research. And the scoop, what I'm working privately on, and I don't know if I will ever succeed because my life is very, very, very busy, but with a great purpose. I'm writing a book.
Oh.
I'm writing a book. It's written in Italian. That's my mother tongue, right? And I think it's going to be also translated in English at some point with one of the biggest publishing house in Italy, Mondadori. And it's going to be exactly on understanding sex and gender differences in the brain. Why our brain as men and women function differently, disease differently, and what the society has to put in place to make a precise society for both men and women. And so this keeps me very busy. I've seen yesterday the cover of the book. I was very pleased. It's a choice that the editor
So when
did.
should we be expecting it?
Oh, that's a very good question. The ambition is September this year, but I'm not sure if I'm going to hit that deadline. I hope, but as I said, the work at the foundation keeps me very busy, of course, together with being a mother and being a spouse. So I hope that I will hit the target, and if not...
You will. So tell us about, you said about brain health, brain capital.
Yes.
So tell us a little bit, define for us, what is brain health, what is brain capital?
I mean, as I said, brain health, it is really the functioning at best of our brain, and might be different for each individual. Nevertheless, it is the conditions that allow us, as we said, to prevent brain and mental diseases, to prevent neurological condition and have this organ performance at best. Of course, it goes also hand in hand with prevention of substance abuse. What it is, the brain health capital, it is a consequence of it. If this brain doesn't work at its best, it has an impact on societal, performance, if you know what I mean. It's about impacting the GDP of each single nation, because we know that when the brain works at its best, we are productive, we are efficient, we live at the best we can, and it has an impact also on our working setting, on our family setting, on how we interact when we go and order a bread from a bread shop or a coffee. And this has, like a cascade effect. It multiplies across individual. A smile that you post to someone else will be a smile in return. And as I said, it allows the society to flourish. So this is the capital of this value of what it is brain health. We've done a study together with the McKinsey Health Institute at the Women's Brain Foundation. I'm here on behalf of the organization I founded and represent. And what we showed, for example, is that the brain health, it's mostly a female concern. And I tell you why, because most of neurological and mental diseases impact predominantly women. So we know that depression, it's 80% female. Anxiety, 80% female. Alzheimer's disease, 70% female. Migraine, 80% female. And the list goes on and on. What we've shown also is that if we invest in brain health and brain research, we have 250 billion return of investment in GDP by 2040. This is exactly what it means, brain capital. It means to prioritize this unmet need and let the society flourish with a GDP that, will hopefully explode, just prioritizing brain health and brain health for women, women's brain capital.
And we know that women live longer.
Women live longer.
But with more inflammation.
Absolutely.
Like you have mentioned. So starting life, at what age do you think we should start taking care of our brain health?
Very, very, very dear question to me.
Because it involves a lot of people. I mean, even within the family.
Absolutely. I mean, if you ask me, it's about already in utero, when a child is in the belly of the mother. That's already when brain health starts for the mother and for the child. And it means allowing a pregnancy and the development of our brain be at its best. I think that for this, we need, again, a societal change that allows also motherhood to be more respected and more, included in a working society, in a performing society. I remember my days when I was expecting my first child or my second-born child. I worked till the very last day, but if I was looking at the working condition around me, that they were not maybe ideal for a mother. So I think that we need to change also the way the working place is meant for women, but we will talk about it later. And then it goes all the way from infancy towards the end of our life. It's about educating to what it means brain health. I give you one metric of what I mean. We have conducted another study which was analyzing sex and gender differences in the so-called patient journey for Alzheimer's disease. Now, let me give you some elements of what I'm trying to tell. First of all, with sex, we refer to our genomic, DNA, whatever it's encoded in our DNA, let's put it this way. Gender, it's more like what the society makes out of an individual with expectations about the role that this individual will have within.
Behavior.
Exactly. Or like, what you feel like to be, like a given gender, man or a woman. And what I want to say is that the study we conducted on the sex and gender impact on the journey of an individual experiencing living with Alzheimer's disease showed, for instance, that women knew less about the disease. And this is what I mean with education. You need to educate everyone to what it means, brain and mental health, and implement those strategies already in school when you are a teenager, when you are a perimenopausal, menopausal woman, and finally an elderly person, what it means. Yeah, that's what I would recommend.
What is, the brain ages. Now we're in the era of longevity. It's all about maintaining functionality, optimizing and everything. How people understand brain aging, and what is the biggest, you think, misconception about how the brain ages?
Right. There is a physiological aging. That's a matter of fact.
Because at the end of the day, you want to keep your independence.
Correct.
To do the things.
Correct.
Yeah.
And that's the most important part. How long we can stay active and independent even at the end of our life. This is what we have to prioritize already when we are 40, 50 if we want to reach that goal. And we will come back to this, sharing what we have learned from the Lancet Commission on prevention of cognitive decline for elderly. But, the truth is that what it is brain aging. Brain aging, it is a physiological process that we will encounter at some point. It lasts the entire life because the brain itself keeps on changing. I wouldn't even say aging. Our brain is changing, and it changes all the time. There was a recent publication, I think a couple of weeks ago, that showed that there are, I think, 3 main phases of brain change. And we know, for instance, that this organ gets to maturity when we are 25 years old, right? It takes 25 years.
So it's developing until that age.
Till that point. We know that the brain is changing until that point. Then there is the adulthood. Then there is the change that happens around 40, 50 years old. And then it continues later on. And that's the beauty of the brain. It's a plasticity. Let me give you some good news. If you manage to change, I don't want to use the word aging. I want to use to change the way the brain functions in an healthy fashion until the end of your life. What we know is that older brains have more creativity, or that some people that are defined as superagers have enhanced mathematical skills. Your maths performance can get better when you're old. And can I tell you something, George? It's happening with me. I was a good student, but numbers were not my strength. So sometimes a 4 will become a 2 and vice versa. And now I see that I'm in the middle of my life. My number capacity is getting great. So it might be a good sign, right?
Can we generalize this to problem solving, or you think
also problem solving? Absolutely. Problem solving is part of it, and actually, maths, it is problem solving.
Yeah, exactly.
Right?
That's why I'm asking the question.
Exactly. And so, creativity, mathematical skills can even improve with older brains. So this is some kind of good news, and it's also about taking decisions promptly, having the maturity to remove that component of uncertainty and anxiety that comes with youth, right? Nevertheless, what we know is that certain diseases, when the brain gets sick, do start very early, and the symptoms are not manifest. And that's the scary part, because it might be that we have an Alzheimer happening into our brain and continuing to evolve, but the symptoms won't be manifested until when it's very late. And that's exactly the same what happened in most of the cases with cardiovascular diseases. You might have an heart attack and not be aware that already since 20 years your coronary artery are impacted by plaques, by cholesterol, calcifications, and whatsoever. And then suddenly, after 20 years, when the process starts, you get an heart attack. The same is with the brain. You have that, in the case of Alzheimer's disease, this pathology starts 20 years before it gets manifested with accumulation of toxic proteins in the brain. And then, we go back to what we can do to prevent those symptoms to get manifested. And we know that there are lots of things we can do to reduce our risk of almost 60% individual risk for developing dementia later on in life by simple things like, nutrition. It goes to maintaining blood pressure under control, diminish your risk of diabetes, correct for hear loss, for vision loss, correct for cholesterol, social interaction. If you have a life lived in isolation, your risk of getting cognitive decline and dementia when you're an older person might be much higher. For women, I give you an element for women, it is about prevention of domestic violence. I always say to young women, one smash today can be your dementia tomorrow. So to be in a toxic relationship, in a violent domestic setting might represent a risk of dementia because of brain concussion and traumatic brain injuries, which are a specific risk for dementia later on. So a lot of things that relates to brain health.
We will go to Alzheimer's. I mean, it's one of the defining health challenges of our time. But before that, I want to ask you if cognitive decline is inevitable. I read a study that biologically, our body is not, our biology doesn't decline linearly, but during our course of life, there are certain ages where we have a sharp decline in a lot of things happening in the body, metabolic pathways and everything. So biologically, is it the same with the brain? Do we have any data on that, or
cognitive decline
is inevitable? Would you say?
I think that there are examples of super agers that do not have necessarily cognitive decline to a level that we think should be impacting the daily living functioning. I have the example of wonderful centenarians that are still performing incredible tasks till the very end of their life. I think that there is a lot to do to avoid that our cognitive performance do decline. And again, it goes back to what you do with your life since you're young.
I've also heard the term of cognitive reserve.
There is a cognitive reserve in each of us. The brain is very plastic. You can train your brain. You can absolutely ameliorate performance of how you have memory capacity, of how you have, executive function capacity, of how your brain is wiring your entire body, how the brain even perceives.
So you train your brain.
I train my brain. I personally train my brain, and we can train our. That's a great news. That's a great news, because to train the brain, it means to hydrate the brain. We need to drink enough to keep this organ functioning. We have to eat in a certain way. We have to keep moving. Moving, it is the key to longevity. I mean, the more you move, the more you walk, the more you exercise, that's the way the brain, it is performing at its best. We should avoid substance abuse. There are some substances that are absolutely deleterious for our brain, and we should stay out of those. And we know which are. This is smoking, this is certainly alcohol abuse, this is drugs for sure. These are all tricks that you can implement already when you're quite young and keep it along for your entire life.
But this is the only thing that works, really, if you think about it. We have all this conversation, we do a lot of research, but always we go back to the basics, which is exercise, movement, food, social interaction, having purpose, and sleep.
Sleep, it's so important. I mean, sleep, it is a process that actually clean our brain from certain toxic component. That's what science shows, that it cleans the brain of what damages the brain. So having a very good sleep hygiene, it is fundamental. And there are even studies proving that the nap, the famous nap, it is beneficial for the brain, which I strongly believe. I mean, it also might explain why certain parts of the world have lower incidence of diseases like Alzheimer, for example, because they have the afternoon nap. But I think it also goes with deficits of certain elements. Think about vitamin D, for example. We know that right intake of vitamin D might prevent Alzheimer. And that's even more important for women, because studies shows that women need an extra amount of vitamin D. Of course, you have to speak with your doctor, with your
professional,
and discuss this carefully. But it shows that even vitamin D might be very beneficial to maintain that cognitive performance, and that's simple like that, right? Or that maintaining, as we said, cholesterol level under a certain threshold, it prevents the brain to age, because there is always a component of vascular together with the classical form of Alzheimer or dementia. So there are little things that we can really do to have that brain, that organ performing pretty well, which is lifestyle, but also, good nutrition, checking that your thyroid works, as I said, measuring your vitamin D level.
Yes. Many people associate Alzheimer's with memory loss.
Yeah.
Is this view outdated?
Oh, yeah, that's a fantastic question. George, I've been working for an organization, a company that was measuring cognition using a machine learning piece that was embedded on our mobile. And we have performed studies that, were assessing memory and, also movement, as well as performance in time and space. I believe that based on that experience and the science we did, but also what I've done during my entire career, that most of neurological and brain disorders can be considered also motoric disorders. It starts a lot with how we move in time and space. Of course, this is very difficult for doctors to picture, because we cannot really assess beginning of an Alzheimer cognitive decline by how the patient moves in space and time, because we are not with that patient all day long, right? I mean, we see a patient for 20 minutes, half an hour, maximum 1 hour or 2, when we are privileged to have that time to dedicate to our patient. And we don't know how that patient works in the home setting, how it moved before and now how it moves now. But believe me when I tell you that all those neurological conditions starts, first of all, with slight motoric, even micro tremors, even micro movement that changes. And this can be measured by all those digital tools that finally are entering in the healthcare system today. So it's a transformation of how we measure brain and mental diseases, relying on new tools that, as I said, are developed on...
So what biomarkers you think we have today that can help us?
I mean...
We
do have already...
And how early?
Yeah, correct.
I think we can detect a risk today.
Of course. I always say that we need to look at the family history of an individual, first of all, and assess the specific risk of that person in that family for developing any condition. And this is true also for neurological disorders. Keeping this in mind, we have at the moment biomarkers that could detect either in your cerebrospinal fluid or within your blood the presence of toxic proteins such as amyloid and tau, considering that amyloid is the first biomarker of Alzheimer's disease, and then tau usually starts to accumulate a little bit later on, showing signs of neurodegeneration. Tau is the more dangerous, let's say, form of protein as compared to amyloid.
More advanced.
Exactly, more advanced and even more a sign of neurodegeneration. But there are also others. There are new ones that are absolutely very relevant, like neurofilament, like biomarkers of vascular damage that happen in the brain and that can be measured in the blood or in the CSF. CSF, it's routine. You can just go to a memory clinic to, a neurologist and ask to assess your genetic risk for Alzheimer, and then as well as your, levels of this toxic protein in the blood. And by assessing a certain ratio, the doctor will tell you, you are at high risk, you already have signs and symptoms of this pathology happening in the brain despite you don't have any signs and symptoms, or you are in an advanced stage of the disease. That's at least for Alzheimer. The same, it's going on for Parkinson, combined with digital tools, digital biomarkers that measures, as I said, cognition, or that can act as a triage. We have a chance to intervene, first of all, with lifestyle changes. That's very important, and I want to emphasize this a lot. And then, of course, hoping that treatment that are now entering the healthcare system might delay the progression of the disease, a disease like Alzheimer. Of course, we don't have yet the cure. That's what I've said at the beginning of our conversation. I'm obsessed with brain health because I worked as a psychiatrist for 7 years in a ward treating people with neurological and mental diseases. And I know how devastating, how chronic, how impactful they can be also on families. And we need to find not only treatment that delay progression, ideally we should find a cure, but it takes the time, it takes the investment and the energy.
So from what you're saying, just a little bit to elaborate, I want to understand a bit better. You think we have reached a stage where we are better at preventing neurodegenerative diseases or just better at diagnosing it?
I think we have three elements that are actually a revolution as compared to when I have started in this field. And let me tell you that it might have been, I'm 51 years old. I got passionate about neuroscience at the end of my medical studies. So let's say that I have researched half of my life in this field. When I started, dementia, neurological diseases might have had a couple of pages in my medical books, right? I mean, it was really a short chapter. We didn't know exactly what it was. I've studied it, and then, you don't know much how to diagnose and what to do about it. It's about 2 decades later now, and we can say that it's not only about diagnosing a disease, but it's also preventing it by knowing what it's good and what it's not good for our brain. And finally, also starting to see treatment entering the market. I had the privilege of being in the team of Professor Roger Nitsch and Professor Christoph Hock. Those were the pioneers who have been developing a drug like aducanumab, which was an antibody that suddenly was able to cross the blood-brain barrier. I just want to stop for a second. Blood-brain barrier. This is how we defined that subtle little membrane that was allowing, filtration of fluid between the blood and the brain. And it was called barrier because we studied 20 years ago that nothing would have crossed that barrier, only very little molecules, like, little drugs. Now we speak about an antibody that can cross that barrier. So antibodies are big molecules, one of the biggest molecules known in our body, in the range of 120, 140 kilodalton. And please, those scientists which are still very much in science, bear with me if I said something not accurate, but my days in the lab are a while back. And what I want to say is that this antibody crosses the blood-brain barrier, goes in the brain, eats up the plaque, removes the plaque, and does the job of actually allowing the disease to reduce the progression in terms of symptoms. And I think this is phenomenal because if you think where we started 20 years ago and where we are today, that gives a lot of hopes. Now, aducanumab has been discontinued for different type of reason. We have new drugs of this kind that are available on the market for patients. And it represents a hope, it represents a treatment, it represents a diagnosis that wasn't existing before. And finally, also preventative measures as the one I've listed that can be implemented to reduce the risk of dementia. One only thing I'd like to tell you is that one recent publication that we just had, I think a couple of months ago, allowed us even as a foundation to basically include sex and gender, actually not yet gender, just sex, as a specific factor for developing dementia. And that's important because we're saying women are at higher risk of having Alzheimer's disease. And it's now finally included as a specific risk factor. And you know why it's important? Because by describing those, you also have that the policy has to do something about it. Like, having better diagnosis for women. We know that women are misdiagnosed most of the time. Yeah. I had many patients that were coming to my attention for symptoms of Alzheimer that were actually first diagnosed with depression. So what I always say is that when a woman changes her behavior as it used to be before, instead of thinking stress, depression, or she's bizarre, she's strange, do an assessment of her cognition, do an MRI, a baseline MRI, see what's happening in the brain, and guide that woman with a diagnostic journey. Again, we go back to our study that we conducted together with the Alzheimer's Disease International. It was in collaboration with with big players. And we find out that women were often diagnosed later than men. So you will have that a woman will have a diagnosis later than a man would have, and often she will see first a general practitioner and then a specialist, while men go straight forward to a specialist when they experience this symptom. And that's having a strong impact on how we manage our patients. The question is why? I can tell you the answer. First of all, women are widowed more often. They don't have a caregiver. They live on their own when they are old. Women are poorer. Whether we like it or not, the wealth of women, it's often lower than the one of a man, so they don't access a specialist.
Yes, they are more vulnerable to neurodegenerative diseases, women. And why you think this has been overlooked for so long? I mean, you are in the Women's Brain Health and
Absolutely.
the Foundation.
Absolutely.
Is it the way society is structured? What do you think?
There are multiple reasons. As I said, first of all, the brain, it is a very mysterious, complex organ. And we just grasped the way it functions, the way disease impacts this organ recently. You know, we are really learning while we talk what it is Parkinson, what it is Alzheimer. These are still complex conditions, multifactorial, where we crack maybe one part with the amyloid component, but there is vascular, there is differential diagnosis, you know, there are multiple type of dementia, frontotemporal, corticobasal degeneration, Alzheimer's disease, Parkinson dementia, you name it, you have it. And this is what we're learning while we talk. Then, of course, on the top of the complexity of this organ and neuroscience, it's very costly. To do science, neuroscience, research for the brain, it is very expensive as compared to other disease area. Imagine oncology.
But it is an investment, no?
It's a huge type of investment that it's needed, and it's very risky because we know that the likelihood of bringing a drug on a market for, brain and mental.
We are ignoring sex, gender.
We are also ignoring sex and gender.
In brain research.
That's absolutely true. And that's the problem, you know, it's the complexity, it is the cost, the type of investment, and then it comes sexism in this type of research and ageism. And I want to pause for a second. Sexism, it's because majority of patients impacted by brain and mental diseases are women, and majority of caregivers are women. So what I often say is that who cares? Women care. And nevertheless, this is a type of caring that doesn't really impact GDP, right? Because caregivers are often unpaid or underpaid. So that's the first problem. Because women care, nobody else care, not even researchers or, you know. And then there is the ageism. All those conditions happen at the end of our life. So often we do not really care, right? Because we see people as not anymore productive. They are out of the society. They are alone. So we don't really prioritize neurological conditions in terms of investments and political measurements needed to either diagnose or prevent or treat. And we go back to sex and gender precision medicine. This was never a topic until, I will say, 10 years ago, 11 years ago. And the Women's Brain Foundation, myself, I think we have been pioneering this discussion globally. I used to work at the Swiss Agency for Therapeutic Products Approval as a reviewer. My job was to assess clinical efficacy and safety of drugs to be approved for the Swiss market. Lots of responsibility, lots of fun, lots of learning, because suddenly you have a new drug you never heard of on your desk and you need to decide, does it work? Is it safe? Can it be approved? Yes or no? And at that time, I have realized that there were profound differences between men and women in terms of clinical endpoints and safety profile of drugs. And I was raising my hands as a regulator, asking the drug developer, hey, why suddenly you have that women perform better on this antidepressant versus men? Or why men are responding better to, I don't know, this other type of treatment versus women? Or men have more headache and women have more bellyache? So it was my individual question as a regulator to scientists on the drug development side that were obviously smarter than me, right? I mean, they had certainly a better grasp of science and they had the best answer possible. And I thought, it cannot be that it's just me raising the hand. Let's organize an association that with scientists start to bring this topic at the top of the agenda and talk about it. And so, George, we literally transformed the ecosystem. I think that at the beginning they thought we were crazy because they told me, are you really sure that you need to do this sex and gender precision medicine and say that Alzheimer's is women? Are you really sure it's important? We've proven 10 years, 11 years along the way that we were right. And we can discuss about it as the entire day because I have so many elements. All I can tell you.
Yeah, I would like to go deeper. And I want to ask you, how can organizations better support women's brain health across, the lifespan?
Absolutely. Let me tell you, the Women's Brain Foundation, we became a foundation last year before we were an association, has as a mission what we define sex and gender precision medicine for brain and mental health. So brain health and mental health are at the top of the work we do daily. And what we think it is absolutely a must, we go back to educating the lay public and all the stakeholders around the table to what it takes to prioritize brain and mental health for men and women. We don't make any distinction. We talk about sex and gender precision medicine. Certainly, women's brain health might be higher as a priority because there is a higher unmet medical need and less awareness, but we do research for men and women, and that's really important to underline. How we do it, we educate. We just translate any scientific discovery we have and we do in a way that the public can understand and digest. We guide women, we guide men in getting the right type of knowledge and access to healthcare system, approaching the right doctor. And sometimes we do also little miracles by embracing the most mysterious diseases. I think you have been fundamental in one of these, type of patient management we've done, right? We've done this together. Your support was also very precious in understanding sometimes mysterious disease of the brain, because let's phrase it, there are still very complex diseases that needs to be diagnosed. And the Women's Brain Project does all this. Educate, helping patients in finding the right way. We do research. We are fostering innovation. So we're basically working with startups in the space of women's health and brain health to let them grow. And that's because I come from the field of startup. I am also a mentor at InnoSwiss. So we really have a lot of strength in identifying those startups that have high chances of succeeding and supporting them with the work they do. Finally, but not least, we work with policymakers. We go up to Davos and educate them to what we think is right, and we shape the global agenda accordingly. We're a small organization, very lean. You asked how...
But you're doing a great job. I mean, I'm following you.
I don't know if it's a great job. It's something I do with passion, with a great team. And, you cannot do anything without a great team behind you. And we believe in what we do. We are growing because we're a young-born foundation, so any support is needed, and it is important to amplify the greatness of the work we do for people. But on the other hand, I was told also that if you want to change the work, you need certainly the asset and the capital, but also you need a great network. And the network of the foundation, it's embracing the entire planet. Actually, let me tell you one thing. I just come out of a roundtable last week with Roche, Bjorn. It's another pharmaceutical industry that it's doing health and major discoveries, but also other players like the European Space Agency, like who else was there? I mean, lots of startups that do commercial space research. And why I'm telling you this, because our network, it's so big that we're all going to bring now sex and gender precision medicine on orbit, meaning we will study sex and gender differences in aging, longevity, and neurology in space. Why? Because we know that in space, the way we age, it is speeding up. It's much faster, and it will be fantastic to be able to replace the long time it takes on Earth to study all these diseases that goes up to, sometimes we decades when we age over time, we just said it, or experiments that takes a couple of years, including clinical trials that are very long. Imagine if we can split it up in space. It sounds absurd because you might argue with me, what? I mean, astronauts are going to be used for this type of research. In a way, they are. They're sacrificing their life already because we know that aging in space, it's accelerated. There is exposure to radiation, there is exposure to lots of elements that bring the body under a lot of stress. So if we can study aging in space and eventually implement preventative measure or therapies in space to avoid this, that's the future. So I'm telling you, our network goes up in the sky.
We touched a lot of things. I have many questions, but the first thing I want to ask is about hormonal changes
Right.
that women go through their lifespan, from their daily menstrual cycle to menopause,
Right.
to pregnancy.
Absolutely.
And so how does this shape brain health
Of course.
for women?
I think that this is a very important question, and science is working to find the right answer. So I'm going to give you a glimpse of what's going on because we don't know yet. All I can tell you is that the brain is highly modulated and wired by hormones. And this is not only true for estrogens, but also testosterone. Our brain, men and women, it is absolutely wired and impacted by those, let's say...
The messengers.
Absolutely. And there is a change during our entire life when it's about hormones and the way they impact the brain. This is true also for teenagers. We know that girls, for example, mature a bit earlier than boys will do, that their hormonal asset, it's modifying the way they behave, the way they perceive their body, and there's also exposing then girls and boys to different way of diseasing already in young ages. Let's think about suicidal behavior in teenagers. Let's think about depression, anxiety. Anxiety and depression is more pronounced by girls. Suicidal attempts more by girls, but suicide execution, it's more predominant in the boys group, right? So it starts very early, and it's also about performing. We know that, for instance, athletes, men or women, when there is a change in their hormonal status, they might change even the performing of their athletic, exercise. But let's talk first about pregnancies and what we know about pregnancy. Pregnancy changes the hormonal asset of a woman profoundly. And if everything goes fine, if you have a healthy pregnancy, I think we can fairly say that hormones like oxytocin will make you have a good pregnancy, a good breastfeeding experience, highly likely, and you will be a highly performing woman, mother, because let's face it, there is a new baby born, and then there is a new mother who is born, a new father who is born, and that level of new life that it's ahead of you, it's really spiked and powered by hormones. I think that without oxytocin, women wouldn't really survive that very challenging time of their life. And actually, there are women who do not have that boost in oxytocin, and lots of hormones and lots of neurotransmitters do not function that well. And that's what we know happening
Makes
with,
an impact.
of course, postpartum depression. That's really an unspoken taboo in our society, but there are women who do not have that, let's say, interactions of hormone and neurotransmitter working properly, and then there is that phenomenon that needs to be discussed, addressed, and even treated seriously. Now we all have certainly societal measurements, but also treatment that can absolutely reduce this symptomatology, which is detrimental not only for the mother, but also for the neurodevelopment of the child, because we know that the interaction mother-child shape the brain of the baby and will allow a proper development towards adulthood. And then there are all the other changes that happens, for example, around menopause, perimenopause. That's another phase of changes for women, right, in terms of how the body is impacted by hormones. Now, let's say that even here we need to distinguish between an healthy menopause and an unhealthy menopause. There are quite some women that face a good transition towards an elderly phase of their life. They won't have the cycle anymore. They will not be fertile anymore, but they will go quite happily through it, right? Some women will tell you, I even didn't realize I had menopause. I heard many women saying that. And then we have the other part, which says, I have lots of symptoms, from brain fog to, fatigue, to difficulties in concentration, to, things like depression. And that's what needs to be taken seriously and addressed with hormonal replacement therapy for signs of menopause, such as hot flashes, such as risk of bone reduction in density, osteoporosis. But let's say that when it's about brain health and when it's about brain fog and when it's about cognition, we still don't know if these type of treatment really have an impact or not. We have to be cautious because still we need to prescribe these elements for the right indication, for the right symptom. So I think that it's all about a learning. We're still learning while we speak, right? I mean, and I go back also to the nutrition, to the fact that women need to have the right elements in these changes that they face. Also during postpartum depression or during pregnancy, that's so important to have the omega-3, to have the vitamin D under control. And this reflects also in menopause and perimenopause.
And love, I'll add.
And love, I mean, what is love? This is, I think, another podcast, right?
Yeah, that's right. So we said that obviously detecting early, it's a good thing. But I want to ask you how early, and if it's too early, do we want to know?
You are talking now about Alzheimer's, right?
Yes, neurodegenerative disease.
I mean, I think, yes, we want to know. And actually, I've read a recent article, which was published yesterday, by the way, by a colleague, a medical doctor with 57. He self-diagnosed that he was having Alzheimer's. And this has the positive side of what he could do. Meaning, I recognized my symptom. I was able to access a diagnosis, a proper one. I was able to change things in my life. We talked about it,
No, it's okay. And I do understand where there is a symptom, but talking about prevention.
Exactly.
So there's no symptom, things are happening years before. I don't know if we reach that stage where we can actually diagnose or screen and when it's early age, somebody in his 20s or something. So he's doing the DNA testing, so he has risk.
You are talking now about familial Alzheimer's.
Yes. So you have a risk. I think there's a lot of ethics here. Do you live, and learn that you are high risk? Then you start living life to avoid the disease rather than living life to have successful living. And I think that's a very...
Absolutely. I think this is a very individual decision. And we know that there is a form of Alzheimer's disease that it is inheritable, unfortunately. It is just within your genes, and you might know whether you have been inheriting that mutated type of genes from your mother and father. It's about the APP gene, the presennin gene, and what do you do then with this type of information? That's your question, and I absolutely think it is an ethical issue here. Some people might want to know. It's about also planning your life in terms of, do you want to have a family? Because, of course, you might pass the same risk to your offspring. It's about knowing what to do with your wealth. Many people want to know because they will plan, of course, also their finance and life accordingly, right? It's complicated. I think that what one needs to keep in mind it is to have a genetic consultation with a genetist that will explain exactly what it means also in terms of the societal impact and the way you are going to live. You are absolutely right. You don't want to chase a diagnosis to then chase the likelihood of preventing that disease that might still happen anyhow or will happen anyhow and live accordingly. That would be a miserable life. On the other end, society has changed. Today we live with long, chronic condition, and we bear a diagnosis for decades, which wasn't like this in the generation of my grandparents. You didn't know what you had. Then they will say, oh, this person had a very bad thing and the next day died. That was the history I heard as a child. Now you have that. You live with cancer. You live with Alzheimer's. You live with,
You're managing the problem.
You are managing the problem. You become a manager. So I think that this is where, again, education and the healthcare system has to change accordingly because you need to let people be empowered with knowledge to make the best educated decision for their life, for their specific circumstance. And I was hearing actually an interview of a lady. This was an Italian lady. It's an Italian story. She didn't know, for instance, that it's possible to have in Italy accompanied, and now I don't know how to define it in English, but it's basically not euthanasia, but it is like relief of pain and symptoms that are devastating, accompanied by, for example, morphine or these kind of things. And this was about ALS, meaning amyotrophic lateral sclerosis. This is a devastating disease. She says, I didn't know. And my husband committed a suicide to get rid of this disease. How terrible is this? I mean, and she says, if I would have known that in Italy it was possible to accompany my husband with this type of medical assistance to relieve his sorrow, his pain, I'm pretty sure he would have not committed suicide. He would have lived in the family a little bit longer. And then at one point, he would have said, now I'm ready to go. And I think, of course, these are ethical questions, ethical elements that were not existing 20 years ago, that were not existing 50 years ago, because we didn't know that ALS existed, because those diseases were not even diagnosed or grasped by medical knowledge. These are absolutely new elements of medicine. So what I'm trying to tell you is that we need to reshape the way we conceive, believe, ethics, and societal need according to the way medicine is advancing. Do you know what I mean? It's about how you manage, you said it, how you manage your life. And it's a very individual choice, but people have to be put in the condition to be able to choose what is best for them.
I want to go back to something you mentioned earlier in our discussion about brain health and mental health. So, are the two connected?
Absolutely. Absolutely. I mean, there is no mental health without brain health. There is no brain health without mental health. I think now we go back to my upbringing in psychiatry, right? I mean, I might say something that it is not very diplomatic or politically correct for my colleagues in neurology and psychiatry, but I think that one of the major problems why neuroscience also had such delay in discoveries and treatment and breakthrough in terms of what we know and what we don't know, it's because we always made that schisma. Do you know this word? I don't know if it's an English word. It's an Italian word. It's like the separation between...
It's a Greek word.
It's a Greek word, you see, between brain health and mental health, psychiatry and neurology. Actually,
exactly.
These are two disciplines that have to live in cohesion because psychiatrists and neurologists should speak the same language and should talk with each other every day. I was very fortunate to also witness this in my career because I was in a ward where we had, at the time, gerontop psychiatry patients, and it was top-hedge way of doing medicine, where you had a psychiatrist, a neurologist, and an internal medicine experts, which means we were always in a dialogue, the psychiatrist talking to the neurologist and talking to the internist. And that's what it is, holistic medicine. This is what it is, dialogue you need to understand and grasp those diseases. This is, you remember, I mentioned earlier that together, me and you, we've helped a young subject that was witnessing a mysterious brain diseases. We didn't know what it was as a diagnosis, or we were going in the limbo. And then you supported me with what you do on a daily basis in terms of supporting me with diagnosis and looking in the blood of this young patient, what was in terms of expression of certain protein and not. Without this interaction and dialogue between the two of us, I would have not learned what I've learned. So as a doctor, you should be really able to speak with everyone and get all the elements you need to make the right diagnosis, the right treatment, and bring the right solution.
Yeah.
With one caveat, the system is not wired for this. We don't have the money, we don't have the time, we don't have the reimbursement, we don't have the mindset.
But certainly we need a multidisciplinary approach because the body is a system.
Absolutely.
One thing changes, the whole system changes.
Absolutely.
And I think that is...
And then we go back to the guidelines, which sometimes force doctors to think within the box. And it's also, of course, a legal problem. You know, if you go out of the box, you are exposed legally. But we should not forget who we are, what we trained for, And what you just said, the entire body, we are a functioning machine where the brain has a big part of it, but everything is interconnected. And without an healthy brain, you won't have an healthy kidney. Without an healthy kidney, you won't have an healthy brain. Because, for instance, when your kidney doesn't work, most of the time it's because of bad nutrition, for example. And it's the brain that let us eat. We eat with the brain, right?
Yeah. I say, emotions, play a very big part in all these create molecules, and sometimes negative molecules, and it does affect the whole system. And this is the work done up here.
Absolutely. You told me once something that stayed with me, like when we get old, we fall less in love, right? I think you told me once in a conversation we had out of this room. And actually, it's true. We do fall in love, all this thunderstorm of neurotransmitters and hormones, but also neurotransmitters, right? You need the dopamine, you need the serotonin, you need
adrenaline,
yeah. Everything, vasopressin, oxytocin, everything plays a role in this wonderful machine. And there are phases of our life where we desperately need it because the brain has to evolve. It's just like that growing and transformation of the brain that makes you become the adult you are. And of course, this type of needs shadow away when you get older because you become more wise, you become more centered, you become more aware of what life is. But emotions, to your point, are fundamental because I think that there is one element of emotion that it's the most precious one that goes beyond love, purpose. I think if you give a purpose to either a 1-year-old child or to a 100-year-old person, the result is going to be always the same, which is joy in what you do. And that's the only parameter, in my opinion, that really matters if you want to measure success of your life. And the purpose can be in cleaning the stable in front of me up to, climbing a mountain or changing the world with a new law. Everything has to have a purpose. And in fact, everything has a purpose. It's just how you pose it, even to kids, right? Or to elderly people. We, at the time when I was in a clinic, our ergotherapy was really like having very old people just being part of the kitchen and cooking with us. And that was making miracle.
Absolutely.
And I tell you one secret of when I was at that time in the hospital. Another thing that really left me astonished, and I want to leave this also with the audience listening, was the power of music. The power of music on our brain and how much music and knowledge of music stays within this organ because it's part of the most ancestral part of the cortex. And I remember that I had patients that were fully psychotic. They didn't know where they were, what their name was, what they were doing. But in front of a piano, because we had a piano in the ward, they would still be able to play music without even reading notes. And that was, for me, that was a compelling reason to force my 2 boys to basically learn to play music and grasp the meaning of an instrument. Because this is, again, the purpose, right? There are some things that give profound joy, like music, learning an instrument actually, or learning...
Mood changes.
Absolutely. And learning anything new. Actually, we know that to prevent cognitive decline, keep on learning new things, new skills, it is just the element that will drive this machine till the very end in a very powerful direction.
I think if you allow me to add to music also art, the design, architecture. And many times I'm thinking about the future cities as the population increases and as lifespan increases, that you are going to have sort of in the same life 5 generations. So you're going to have a multi-generational society that you need to homogenize. And I often ask the question, how do you manage? How do you build resilience? Because it's a very big challenge.
I have my opinion on this, and I have my plan, by the way. I think that what you are mentioning, it is absolutely compelling. And for me, one of the main disasters of our current Western society, it's solitude. The fact that we are alone, loneliness. It's as dangerous as smoking 1 package of cigarettes per day or like sitting all day. Sedentary life and loneliness, it is highly, highly risky. So to your point, the purpose, the resilience, the interconnection among individuals, I think we have to go back to the community that we had in the past.
Different generations,
Different generation living together.
100-year-old with a 20-year-old.
Absolutely. And believe me, if we will use the potential of a 60-year-old brain or 70-year-old brain or 80-year-old brain at its best, even in helping the society, that's where the purpose come back, and we will prevent a lot of bad things happening, including brain and mental diseases or neurodegenerative condition. I give you an example. For instance, what if we will start to put in children homes, like nurse, baby kindergarten, right? Elderly people supporting and helping, in managing newborn, in managing babies. This is so powerful, but we've forgotten that this can be done. And then our old people sit at home alone all day long with no purpose whatsoever. So the dream of the society and the city I see in the future, it's really that interconnection, the living together. People have to learn to live together. And this is also something that you have to learn to do when you're very young. I see too many people that suddenly want to have help when they're very old, and they don't get along, of course, with an intruder in their house, right? Because they were always living alone and they don't want to have any help, and that's a big problem. The refusal of caregivers by elderly people, especially for my generation of women and men who have now aging parents. I always challenge this part, saying if these people would have had that type of interconnection and living together and community already when they were younger, and beginning with 40, 50, getting help in raising kids. Many women tell me, how have you done this brilliant career? You have 2 boys, you've got a husband, you have this to manage, this to do. Delegate. Delegation and getting the help and living in a community. That's what I've done. I have created always a community of people supporting my goal that was my family first, my job second, and my well-being third. And I think it works. But you have to enter in that thinking that you have to trust. Sometimes it doesn't work well. You have to maybe change the person, change direction, change relationship. You have to invest. It costs. You can't have it all in life. You have to invest your own asset to make this a reality. And yeah, you also have to be, of course, lucky and surrounded by the right people. Let me say that, like you today this morning.
Thank you. And you talked about social isolation. So what do you think is now happening with all the social media? Australia banned.
Oh.
So what is your...
We go back to the brain and brain health.
Brain, yeah.
And actually, I recommend the listener to read the report of the McKinsey Institute of Health that was just launched at Davos about how brain health and AI, artificial intelligence, are interconnected. And you will find very interesting element of what the society of the future might look like. But let me introduce to you an element that it is, first of all, digital dementia. It's a thing. It's happening. And we know that the abuse of not only social media, but in general, internet and AI, it is reducing our capacity of thinking and logical thinking. And this is very true for kids and for teenagers. So I think that introducing certain elements like social media when kids are adult enough, if there is ever an adulthood in a young person, as we said, the brain finished to mature with 25, right? It's always the best. I mean, when I see toddlers with unlimited access to content like videos or iPad, I think this is not correct for the brain development itself and for the behavior, because the dopamine spike that those instruments have on our brain, it's exactly the same as we go back to smoking cigarettes or consuming alcohol or using cocaine, actually. So to be very, very frank. And you see it because when you remove certain instruments from someone, it's like you have to go through a detox. It's very, very difficult to detach from...
Out of your comfort zone.
Out of your comfort zone, your dependence.
Yeah, your dependence.
Let's name it.
But you also see, if you even walk in a big city, you see people always walking looking at their mobile instead of actually looking at the sun. You see a couple having dinner and they are on their phone, and this must be making a huge impact.
I think we go back to the loneliness and to the fact that we have forgotten how important it is communication. There are profound studies that says that the people who live longer, the centenarians actually, are the ones that have the highest purpose in life and they have the highest network around them. So what I always say to people, if you want to live long, have chit-chat. Remove that mobile in front of you and just talk with the person next to you on a train or when you go buying your bread. It's shown that people that have small chit-chat with strangers are the ones that are the happiest and the ones that live the longest. So that's another very simple measurement to extend your lifespan, right?
Yeah. We're reaching our closing, and I want to ask you your opinion. What should women understand today to protect their future cognitive health? What would be your message?
We are, at the moment, at the Women's Brain Foundation, conducting a very important study, which is called BRIGHT. The study, it is actually developing a screening tool for women who are perimenopausal and menopausal to understand which type of symptoms belongs to real menopause and the so-called brain fog, emphasizing that menopause starts actually in the brain first and then it impacts the rest of the entire body. Mm-hmm. And what else belongs actually to underlying, beginning neurological or mental disorders. And I'm referring to Parkinson, I'm referring to Alzheimer, I'm referring to depression, anxiety, and all these kind of things. This started because a gynecologist collaborating with us at the foundation knocked at our door and said, you know what, I would like to publish a case report on a patient that came to my attention around age 50 years old with disturbances related to menopause, but my intuition brought me to understand that this was the beginning of an early Parkinson disease. So we work at the foundation with clinicians, with researchers, with patients, again, the stakeholders around the table. And then we thought, okay, let's do a screening tool, a triage tool that will help the doctor to understand what it's real sign of menopause and what it is first signs of something else. So when you ask me what women should be doing, we go back to your question. Women should take seriously into account any sign that it's a change as they used to be before, in their behavior, in their performance, in their being. When it's like that, they have to seek for medical advice and insist on a proper assessment, because very often women get dismissed with like, oh, this is stress, you're unhappy, this is just menopause, this is that. No. Demand for an assessment, demand for a baseline MRI actually, even if it's nothing, just to have a referral for later on in life and to say, with 50, that was my brain looking like. And now I'm 70, this might have changed. So this is my recommendation in a medical term. Then, of course, put in place all those elements that allow you to reduce risk of developing either inflammatory diseases or cognitive decline or, diseases of our Bewegungsapparat in German, of our mobility system, like muscles and bones. We know that women might be prone to more osteoporosis, for example. So which means check for your vitamin B level, check how your thyroid is functioning, check how it is your blood pressure, talk to your doctor on what you can do if you need hormonal replacement therapy, for example, if this is a measure that might benefit you and how it can be benefiting you, because there are also different type of formulation and this kind of thing. And then, of course, we go back to lifestyle. Delegate, don't get the burden of caregiver on you on your own. Stay socially engaged, do a lot of movement and keep on, as I said, walking as much as you can. Read, learn a new task, to play an instrument, we said it, or to create art. Yeah. Anything that keeps your brain flourishing and gives you the purpose in life, but also get those elements of medicine and medical care that might improve the quality of life. And it goes also with omega-3, very important for brain health. Absolutely.
Yeah. Technology is going too fast. And society development not at the same rate. So to me, it seems that there is a challenge.
Of course.
Nowadays we talk about super intelligence, re-engineered intelligence. Technology really moves fast. And a lot of people I see also using wearables. They have these fantastic technological achievements where you can test, you can do all kind of things. And at the end, everybody, we live in a society which is high performance. And at some point I feel, and I want to know your take on this, that having all these technological advances without biologically being able to follow them, when we're living data-driven lives, what is the impact on us, on our brain? Should we be using these technologies to be data informed, as opposed to be living, because you mentioned about joy, happiness and everything, but when you always want to optimize, when you always want to have peak performance, we always talk about performance, we never talk about recovery. And to me, this is a very big subject on brain health, on body health, on all aspects of health.
Absolutely. And you have used one word that it's a very important one. It's about recovery. We live in a society that it goes indeed too fast, where efficiency it's improved also by, for instance, the daily use now of something like artificial intelligence. Let's think about ChatGPT. Anyone almost use it daily. And this means that we become faster, more efficient. But as you said, do we have the brain reserve, the brain resilience, and the time to, recovery after all that speed that it's in the flow of thoughts we have? I think the answer is unfortunately not. We have not yet implemented within our society a system that says, now it's enough. Mm-hmm. Actually, it's the opposite direction, which we just want to overrun, overperform, overproduce. And I think that's not sustainable. That's not sustainable. And I believe that the young generation, frankly, would find a solution. And I tell you why. Yesterday, I had a meeting with the founder of a startup. Her name is Joy Bordini, and she's developing a tool that it's capable, by passive monitoring of your behavior on your telephone, what is your brain health status. So no interaction, active interaction, just by holding your phone in your hand and how you behave with your phone, which we, of course, each of us does. I mean, we no one of us is living without a smartphone anymore. We can get insights of how it is your mood, how you are reacting to events. Are you happy? Are you sad? Are you suicidal? Are you sleeping good? Are you not sleeping good? And then there is the alarm signal. When things goes off the line, then you get an alarm and say, hey, put this machine away. Or, hey, go for a walk. Or, hey, you are having problems because you're not leaving your room, your office. You have to move. And I think that this is very important, especially when we go back also to parenthood and children. Imagine if you can use this tool to see how your child, who is in a school or in a holiday or in a camp, behaving in this regard and prevent things like depression, suicidal attempt. We know that unfortunately there is a spike in this kind of things among teenagers and young people. So I want to say that this is happening. We have a fast society that it's not able to manage all of this, but signs like, reducing access to social media in people that are not older than 16, so younger people shouldn't have it, or solutions like the one I described to you that the startup is developing will allow us to be better educated and better interact with all these technological tools that are invading our life. And sometimes it's overwhelming. I also heard that Nordic countries are removing electronic voice from answering telephone answers, automated telephone answering, because it's frustrating. People need human contact. People need the people on the other side if we want to have this machine functioning right. And it is so true that in the end, if this doesn't happen, you even get dementia. And we know how compelling the numbers of dementia are in our society. We're going to have a future where majority of elderly people will be confronting with this condition if we don't do something about it. So we have a huge responsibility as educators, as healthcare providers, and as people.
So, yeah, I agree. I totally agree with you. Just to conclude and finish off for our audience, if our audience needs to remember only one thing, about protecting their brain health over the next 30 years, let's say, what could it be?
Learn. Keep learning new elements of what it is medical discovery, what it is new ways of preventions, what it is learning a new instrument, and learn what it is to make a piece of art. For me, the learning component, it is the key to a long, meaningful life that will put brain health at the center. And too often, by overperforming, we forget that we need to take time to learn something new.
Antonella, Dr. Chadha, thank you very much.
You're very welcome. Thanks.
Thank you for listening. For more, visit Chenot.com. The information in this podcast does not constitute medical advice. Always speak to your doctor or another qualified healthcare professional about your individual needs.